Hello and welcome to Nursing 410, my persuasive argument on alarm fatigue. It is a manageable issue. The objectives: describe the background and impact of alarm fatigue, examine the impact alarm fatigue has had on patient safety, explore whether the healthcare field is overusing alarms, and look at strategies and technologies that can help improve patient safety. Alarm fatigue occurs when clinical areas are inundated with constant noises. They can be alarms from monitoring equipment, telephones, conversations, or any noise that desensitizes the healthcare worker to the urgency of an actionable alarm. Desensitization to alarms has caused slow or non-existent responses to alarms, leading to increasing catastrophic consequences over the years. This has grown to such proportions that the Joint Commission has issued national patient safety goals in relation to alarm events. What can we do as healthcare providers to dramatically decrease alarm-related events? Are we overusing alarms, or do we need to use this tool more appropriately to realize their utmost benefit? Alarm fatigue. The history started 2 decades ago, where medical errors and alarm fatigue were brought to the forefront. In 2011, the Advancement of Medical Instrumentation convened a medical device alarm summit, and they created an alarm best practice work group to address the problem of clinical alarm fatigue. In 2012 and 13, the ECRI identified clinical alarm hazard as the top potential danger in hospitals and healthcare environments. Alarm hazard has been the first or second top 10 technology hazard for the last 6 years. In 2013, the Joint Commission issued a Sentinel Event Alert, and that because 98 alarm-related events were reported between 2009 and 2012. 80 patients died. 13 individuals experienced permanent loss of function, and 5 events led to unexpected healthcare and extended hospital stays. Deaths related to alarm fatigue have been brought to the public attention. The Boston Globe reported 119 deaths of ventilator-dependent patients due to alarm fatigue during the 6-year period to May 2011. The Globe's report supports the many academic studies indicating that hospitals have become noisier and that hearing the sound of an alarm, identifying it, and providing a timely and appropriate response have sometimes become intractable problems. False alarms. A recent study measured a total of 2,176 audible alarms during a 928-hour patient care and found that 94% were false positives. In 2006, 1,327 healthcare professionals involved in clinical alarms, 81% of them agreed that nuisance alarms occur frequently. 78% agreed that these nuisance alarms disturb patient care. A major contributing factor for the increasing noise level in these environments is the number of false alarms generated by medical devices. The intensity and frequency of medical devices and alarms in hospital settings is a major issue. Nuisance alarms. 77% of respondents indicated that nuisance alarms disrupted patient care, while 81% indicated nuisance alarms occurred frequently. This reduced the trust in alarms and hindering rather than improving patient safety. Are we overusing alarms? Are we not addressing other interventions? Are these patients not being screened? Are we not trying more basic interventions like toileting? Are we ignoring the fact that these patients may have dementia and just need reorientation? They may need one-to-one care. Are we really addressing other interventions? The Johns Hopkins Hospital reduced pulse ox alarms by 63% in a step-down unit by reducing the alarm threshold from 90% to 88%. These were patient-specific parameters based on alarm thresholds. We could use time delays between events. A time delay may be one of the most simplest and effective methods to reduce alarm occurrence. Are we performing a procedure? Is the patient shifting in bed and we're helping them change position? A time delay would really be effective. When actionable alarms occur, the assigned nurse needs to be notified that she can respond before the patient further deteriorates. With improved notification technology, wireless technology could send this notification right to the nurse's pager or a cell phone. Monitor technicians could more appropriately dispatch the nurse to the proper room. Priority sounding, high alert, medium tones, beeping, chirping. We can really prioritize some of these sounds. Any and all these interventions can improve patient safety. In conclusion, by understanding the cause of alarm fatigue, we can more accurately and efficiently address it. Alarms are a tool, and if used properly, we can use it to its full potential. Proper screening for the need of alarms will reduce overuse and decrease desensitization. Based on the interventions and improvements by other facilities noted, alarms are useful and a viable way to promote patient safety. Thank you for watching my presentation.